Alright, so this is day 10 following a rhinoplasty surgery. Also, patient had facial asymmetry on the left side. This is a splint that we placed to secure the graft, the rib graft that we have harvested. And the sutures for the rib graft, it's healed well. They've all been removed. Okay. Yes. It's nice. So if you can see in the frontal view, you can appreciate that. Can you hold this? Yeah, hold it a bit down. Yeah. So the dorsum was very broad, that has been narrowed down, and your tip was quite bulbous, that has been made straight and sharp till from the radix till the tip. There was a depression at the radix which has been augmented using the rib graft. Also, there was he had a broad nose, we reduced it a bit, also narrowed down the dorsum, performing a radix osteotomy on both sides. You see both the stitches here. There still is some amount of swelling in this part of the nose, but it will settle down. Also, the malar bone has been worked upon to correct the asymmetry that was there. There you go. Look up. Yeah. So you see now both the cheeks are at the same level, whereas here you can see a depression on the left side, and that has been worked upon. Alright, so we'll proceed with the suture removal now, and I have to tell you that we've done a bicoronal approach for this patient, and we have already removed the staples yesterday. It's healed quite well. You see this ointment here. So this is the bicoronal scar, quite well healed. It's all the ointment. You can have a head bath now, need not worry. So this is a hidden scar, the hair will grow over it, it doesn't have to worry about it. So this entire surgery was done through a bicoronal approach, because we also did work on the forehead, and he wanted some amount of forehead osteoplasty so that he can have a flat dorsum and not an elevated and a depressed depressed forehead here.
So we've done a surgery on the forehead. You can see that huge improvement. He had a ridge on the forehead there. I'm just going to explain this to you. So look at his forehead. This is just 8 days after surgery. There's a big bony growth here. There's a growth here. These are kind of bony depositions that the patient's having on the forehead. So we've made that nice and smooth. You can see the width of the forehead. It's really nice now. Along with that, I've also done a nose. We've done a little work on the cheek. So you can see the change in the shape of the cheek a little bit. Beautiful nose. You can see that point change. So the forehead was done through the head. You can see the coronal incision. It's all healed up beautifully. It's going to leave no scar. Alright, come this side. So we're going to show you the side view of the nose now. This side. Look at that. So he had a bump there. Now it's a straight line, straight nose. And we're going to show you. You can look at this way also. There's a huge ridge that he had. Taken care of that. And then now this side. Once again, you see the improvement. I think it's phenomenal, and it's going to take a while for all of these things to heal. All right.